Good morning, everyone, and thank you for joining us. I'm showing it is the top of the hour, so we'll go ahead and get started. My name is Karen Curtis, and I'm a Provider Outreach and Education Specialist at WPS Government Health Administrators. I'm joined today by my friend and colleague, Aline Sigler. Today, I'll be discussing kidney health and providing some information on Medicare services that are available not only to detect early signs of kidney problems, but also to help beneficiaries who may have risk factors associated with chronic kidney disease. Before beginning my presentation, I have a few things that I need to go over. The link for this webinar's materials included two handouts. One was a copy of today's slides presentation, and the other was a document titled Timely Topics. This document is not specific to this event, but it does contain items that we want to make sure that you're aware of. There are a few ways to get this information. One way is to visit the live events page of our website. In the column titled Materials, you will find a link that will take you to WebEx. You will then be asked to enter the event password, which is education with a capital E. Links were also included in the WebEx reminder emails. The first reminder would have been sent out yesterday and the second reminder about an hour ago. Those emails contained a link labeled Download and Preview Webinar Materials, and I've included an example in this slide so you can see what it would look like. If you didn't receive these emails, be sure to check your junk or your spam folder. You will want to be sure to add messenger@webex.com to your safe sender and receiver list to prevent future issues. And finally, Aline has added a link to the chat along with the password. If you do continue to have difficulties, please email our education mailbox at wps.gha.education@wpsic.com and someone will assist you. This event is being recorded, and unless there are technical difficulties, the recording will be loaded to our YouTube channel as an encore presentation. We are offering the same session at 1 o'clock Central this afternoon, and we'll choose the better of the two recordings to use as the encore. We've made some recent changes to our encore page that I think you're going to like. We've added links to our presentation and to the surveys. So this will give you additional opportunities not only to obtain a copy of the slides, but to provide feedback regarding the education you receive from us. If you have questions regarding today's topics, please enter those in the chat and send to all panelists. Aline is monitoring the chat, so if questions are sent to host and presenter or to one of the other panelists privately, it could get overlooked. I do have a lot of material to cover today, and I'll take questions as time allows. If we don't get to everybody, if there's unanswered questions from the chat, then those will be compiled after the event. And we'll take those along with any follow-up questions we get, and we'll get the answers sent out to all the attendees. After this event is over, if you happen to think of a question that you wish you would have asked, you have 10 days to submit it to our education mailbox. In the subject line, put today's date and kidney health. This will let staff monitoring the mailbox know that your question is related to this event and should be sent directly to myself and Aline. Remember that claim-specific questions would go to customer service since they are able to access the system and go over your claim with you. This next slide is our disclaimer. We do our best to provide the most current, accurate information, but as we all know, Medicare rules change often. The information I'm presenting is accurate as of today, but the CMS website should be checked regularly as their rules and regulations will take precedence when determining final coverage criteria. Recording of this event is prohibited, and as I mentioned earlier, this event will be added to our Encore Presentations webpage. So if you want to go back and refer to something I talk about, or if you have a coworker who may have missed the event, there will be an opportunity to view this at a later date. Although I'm sure many of you will be familiar with the terminology I'll be using, I have provided a list of acronyms and abbreviations for reference. Today we will cover risk factors associated with kidney disease, the 5 stages of chronic kidney disease and how it can be diagnosed, and finally we'll discuss related preventive services offered by Medicare and how those services should be billed. Every 30 minutes, our kidneys filter all of the blood in our body. They play an important role not only by removing waste and balancing our body's fluids, but they also help in the production of red blood cells and regulating blood pressure. I'm going to start out today by giving you some numbers. According to the Center for Disease Control and Prevention, or the CDC, kidney diseases are one of the leading causes of death in the U.S. Although 15% of the population, which is around 37 million people, are estimated to have chronic kidney disease, 90% are undiagnosed because symptoms normally don't appear until a significant amount of damage is done. Studies have found that diabetes and high blood pressure are the leading contributors in new cases, with diabetes taking the lead at 47%. If no action is taken, chronic kidney disease can lead to kidney failure. When this occurs, a dialysis or a transplant will be needed for survival. There are also many social factors that not only increase a person's chance of developing kidney disease, but once diagnosed, they can cause the condition to worsen. Many beneficiaries are on a fixed income, and sometimes this can lead to food insecurities or unstable housing situations, which can adversely affect their health. Some individuals may not have reliable transportation to take them to doctor's appointments, and this can lead to delayed diagnosis and treatment of certain medical conditions. Next, let's discuss who's at risk. Those aged 65 and older are at increased risk of having chronic kidney disease. Why is that? Our older population has a higher prevalence of diabetes, high blood pressure, and heart disease, which all are contributing factors. Diabetes and high blood pressure can cause damage to the blood vessels within the kidneys. Once that occurs, they can no longer filter blood as effectively, which leads to fluid and waste buildup in the body. Researchers are still working on how heart disease and kidney disease are related, but one thing is clear: having one seems to directly affect your chances of developing the other. Those who have a family member who have been diagnosed with chronic kidney disease can be at higher risk. Some races seem to be predispositioned to kidney-related diseases. Obesity has been known to lead to the development of diabetes and heart disease. Extra weight can cause the kidneys to work harder and over time lead to damage. So what is chronic kidney disease? Chronic kidney disease is defined as having a kidney abnormality for 3 months or longer. This means the excess fluid and waste that the kidneys cannot filter remain in the body. As time progresses, decreased kidney function can lead to other health issues such as anemia, weak bones, loss of appetite, and depression. A patient's risk of heart disease and stroke also increases, which can lead to early death. Although irreversible, kidney disease does not always have to lead to kidney failure. This is why early detection is so important, so that treatment of the underlying causes can slow progression. As we go through the 5 stages of chronic kidney disease, I want to let you know that during stages 1 through 3, the kidneys are still able to filter waste out of the body. Once we get to stages 4 and 5, the kidneys must work harder and may stop functioning. So during stage 1, damage is mild. The kidneys are still functioning as expected, and at this time the patient probably isn't experiencing any symptoms, but protein may be found in a urine sample. Other symptoms could include high blood pressure, swelling in the hands and feet, urinary tract infections, or blood in the urine. A lot can be done this early in the game to keep kidneys functioning, so treatment should center on reducing risk factors. Individuals should focus on developing a healthy lifestyle, starting to exercise, stopping smoking, and getting sleep are all important. Stage 2 is a lot like stage 1. Most of the time, kidneys are still working well, and the patient may not be experiencing any symptoms, but it is possible to find protein in a urine sample. Other symptoms are the same as what we saw in stage 1. Again, a lot can be done to keep kidneys functioning, so treatment should focus on reducing risk factors. This would include treating diabetes or high blood pressure if the patient has been diagnosed. Eating a healthy diet and finding ways to reduce and manage stress would also be helpful. Stage 3 is broken into 2 categories based on the patient's estimated glomerular filtration rate, or eGFR. We will talk more about eGFR in a few minutes, but kidneys are now damaged but are working well enough that dialysis or transplant are not needed. If the patient falls within the 3A stage, they may not be experiencing any symptoms. Others may start to feel tired or weak. They may complain of back or pain in the lower back, muscle cramps, or trouble sleeping. Stage 3B is marked by increased damage to the kidneys, which may cause the patient to start to feel ill. Treatment should be focused on the symptoms. This may include adding iron supplements for anemia or calcium and vitamin D supplements to keep bones strong. Physicians may need to look at what medications the patient is currently taking to determine if they could be causing more damage to the kidneys. This could include medications that are not prescribed. As we move to stage 4, the kidneys are not working as well and are having a hard time filtering waste out of the body. This is the last stage before kidney failure. You may find that patients at this stage have anemia, bone disease, or calcium or vitamin D deficiencies. The blood may now contain high levels of potassium and or phosphorus because of excess waste building up in the body. Along with treating the symptoms to decrease damage, options such as dialysis or a kidney transplant may need to be discussed. Severe kidney damage has been done by the time we reach stage 5. If the kidneys are still working, failure may occur soon. Blood work may show high levels of urea since the kidneys are no longer able to effectively remove waste. Treatment options at this point would include dialysis or a kidney transplant. So what are some of the known causes of kidney disease? Diabetes and high blood pressure are the 2 leading causes. Some patients may develop a disease that affects kidney function. Along with those listed on the slide, kidney stones and urinary tract infections have been known to cause damage. Although urinary tract infections normally involve the bladder, they do have the potential of spreading to the kidneys. Sometimes kidney damage can be inherited or congenital. Polycystic kidney disease is the most common inherited. Congenital diseases usually occur in the urinary tract during the development of the fetus. Over-the-counter pain relievers and some illegal drugs also have an effect. As we age, many of us seem to get more aches and pains than we did when we were younger, and this could cause us to reach for the Advil bottle a little more often. Along with over-the-counter medications, I've listed some illegal drugs that can take their toll. Lastly, alcohol can affect the kidneys in a way that alters their ability to work effectively. We've talked about the stages of chronic kidney disease and some of the causes, so now let's talk about how this disease can be diagnosed. Blood and urine tests can be ordered to measure kidney function, but sometimes imaging tests and biopsies may be needed. Serum creatinine will measure the amount of the waste product creatinine found in the body. Although this number can fluctuate, the lower it is, the better. The estimated glomerular filtration rate estimates the kidney's ability to remove waste from the body. We will talk more about this test in a minute, but in this case, the higher the number, the better. Blood urea nitrogen, or BUN, is another test measuring the level of the waste product in the blood. A urine test is another common tool to detect signs of kidney abnormalities. The tests listed here focus on measuring levels of proteins, or albumin and creatinine. While filtering the blood, the kidneys should keep protein in, which means that little, if any, should be found in the patient's urine sample. There are times when blood and urine tests may not be enough. Healthcare providers may need to use imaging tests, such as ultrasounds or CT scans, to detect abnormalities. Not only would these tests show any developmental irregularities, but they could also detect cysts, tumors, or obstructions. It could also be used as a diagnostic tool in cases where polycystic kidney disease may be suspected, or to monitor the progression. The last test I'm going to mention today is a kidney biopsy. This could be something that may be necessary after all other tests have been run and more information is needed. And biopsies may also be needed if a patient is having trouble after a kidney transplant. You've heard me mention the eGFR a few times already, but now I'm going to get into a little more detail. In the early stages of chronic kidney disease, many people don't show any symptoms. And for this reason, physicians and other healthcare providers may recommend this test for patients who are at higher risk of developing chronic kidney disease and have risk factors such as diabetes, high blood pressure, or family history. The test measures how well kidneys are working and considers age, gender, body type, and race. Recently, I have read that the National Kidney Foundation is working to get race removed as a factor. Chronic kidney disease is usually diagnosed when a patient shows decreased kidney function, which is an eGFR of less than 60 for more than 3 months. This slide shows you the correlation between the eGFR blood test numbers and the stages of chronic kidney disease. During stages 1 through 3, the focus will be on treating complications and slowing the disease or preventing it from getting worse. Stages 4 through 5 focus on planning for kidney failure. I won't go into as much detail as I did earlier, but once numbers get below 60, you are going to see loss in kidney function. At stage 4, patients will most likely start seeing a kidney specialist, and at stage 5, kidneys have failed. End-stage renal disease, or ESRD, is a medical condition where the person's kidneys have stopped functioning permanently, resulting in the need for long-term dialysis or a kidney transplant in order to survive. So let's talk about diagnostic laboratory tests for patients who have been diagnosed with chronic kidney disease. I realize that this slide has CRD for chronic renal disease, but the names refer to the same condition of losing kidney function over time. Once kidney damage is done, it is important to monitor patients to determine the best treatment to help slow the progression. The tests shown on these next couple of slides may not be all-inclusive. There may also be some non-routine tests ordered, and these are usually justified based on the patient's diagnosis. Like always, make sure to document the medical records to show medical necessity. The information shown has been taken from NCD 190.10, and a link has been provided if you would like to get more details on this topic. Here we show tests that would be taken per dialysis session and weekly. There is a long list of tests that can be billed monthly, including potassium and phosphorus, which may be seen at high levels once the patient has reached stage 4. Additional tests can be billed once every 3 months. Hepatitis B tests are also covered when the patient first enters a dialysis facility. The NCD does provide a chart to help determine when future testing, if any, should be done, so be sure to click on the link provided so you can get more information on that. Additional information regarding hepatitis B screening and vaccines can also be found on the Medicare Preventive Services tool, which will be discussed later. Now let's turn the focus to what can be done to help individuals keep their kidneys functioning and helpfully avoid chronic kidney disease. I'm going to cover some of the preventive services that Medicare offers concerning those conditions that can damage the kidneys and put patients at greater risk for medical problems down the road. I'd like to start with diabetes, since it's the leading cause of chronic kidney disease. Diabetes is a condition in which the body has trouble controlling the amount of sugar in the blood. The pancreas either is not making enough insulin to control the amount of sugar, or the body is not able to use the insulin effectively. This causes the kidneys to have to work harder and will eventually result in damage. Diabetes screening is covered for patients with Medicare Part B who have certain risk factors listed here, or who have been diagnosed with prediabetes. Notice that in some cases, 2 or more conditions need to exist. Blood glucose lab test screenings are covered if the doctor has determined that there is a risk for diabetes. There is no cost to the patient if the provider accepts assignment. The reason for the asterisk is that patients who were previously diagnosed with diabetes are not eligible for this benefit. An exception to this rule would be gestational diabetes. Here you can see the list of applicable HCPC and CPT codes. The claims should include diagnosis code Z131. Patients diagnosed with prediabetes are eligible every 6 months, while those who have not received that diagnosis or have never been tested would be eligible every 12 months. Modifier TS should be used when the patient has received a previous diagnosis of prediabetic. Diabetes self-management training teaches patients to cope with and manage diabetes. This can include tips for healthy eating and being active, monitoring blood glucose, and taking prescribed medications. These patients may also be eligible for medical nutrition therapy, which will be covered later. This service is covered under Medicare Part B for patients with a written order from their physician or qualified non-physician practitioner and who have not already received initial training under this benefit. Group training sessions consist of 2 to 20 individuals, and all of them do not need to be Medicare beneficiaries. For follow-up training, sessions should not be less than 30 minutes, and the physician will need to document the specific medical condition addressed during the training. G0108 will be used for 30 minutes for individual sessions, and G0109 is for 30-minute increments of group sessions. Patients must have been diagnosed with diabetes to receive this benefit. For the initial year, patients may receive up to 10 hours of initial training within a continuous 12-month period. 2 hours of subsequent training would be available per calendar year after completing the initial 10 hours. Please notice the additional coding that states diabetes self-management training And medical nutrition therapy cannot be billed on the same day or incident to professional services. The Medicare Diabetes Prevention Program began in 2018 to prevent type 2 diabetes in beneficiaries who had been diagnosed as pre-diabetic. The program focuses on changes in diet, how to increase physical activity, and strategies for weight control. These services would be available for up to 2 years. The first year consists of at least 16 sessions offered at least 1 week apart for the first 6 months. 2 3-month maintenance sessions would be offered during months 7 through 12, and during months 13 through 24, up to 4 3-month maintenance sessions would be available if beneficiaries meet weight loss and attendance goals. To qualify for this once-in-a-lifetime benefit, all conditions shown here must be met within 12 months of starting the program. Here's a list of the HCPCS and CPT codes that are used to bill for the program. These codes are broken down into core sessions, maintenance sessions, and those sessions that occur in subsequent years. The maintenance sessions are further broken down into the specific months in which the session occurred. In the list of resources, I've provided a link to the Medicare Diabetes Prevention Program Expanded Model Booklet, which provides additional details regarding these codes. This service is for patients diagnosed as pre-diabetic, but other ICD-9 or ICD-10 codes may apply. This is a once-in-a-lifetime service, but codes G9890 and G9891 are exceptions. G9890 is for a bridge payment. This occurs when the beneficiary had their first core session with a different supplier. A supplier may only receive one bridge payment per beneficiary. Code G9891 is a non-payable code that is used to report attendance at a session that is not associated with the performance goal. This code should be billed on the same claim as the payable code with which they are associated. So let me explain this in a little more detail. For example, code G9873 is for the first core session, and code G9874 is to report that a total of 4 sessions were attended. So you would use code G9891 to show attendance for sessions 2 and 3. Medical nutrition therapy consists of a registered dietitian or nutrition professional providing nutrition and other lifestyle changes that can help manage certain medical conditions. If a patient is getting dialysis in a dialysis facility, Medicare would cover this service as part of their overall dialysis care. This service is covered under Part B with a doctor's referral for patients who have been diagnosed with diabetes, kidney disease, or have had a kidney transplant within the last 36 months. Services must be provided by a registered dietitian or nutritional professional, and there is no cost to the patient if they qualify. Here is a list of codes used to bill medical nutrition therapy. Patients may receive 3 hours of one-on-one counseling in the first year and 2 hours for subsequent years. Also remember that medical nutrition therapy and diabetes self-management training cannot be billed on the same service date for the same patient or incident to a physician or non-physician practitioner's professional services. We'll now move on to the second leading cause of kidney disease, hypertension. High blood pressure can be diagnosed during the initial preventative physical exam, as well as the annual wellness visit. The initial preventative physical exam, or IPPE, is also known as the Welcome to Medicare preventative visit. Medical professionals can assess patients for risk factors that could lead to kidney issues and may provide early detection of some health issues. This visit is covered once per lifetime and should occur within 12 months of the beneficiary becoming eligible for Part B Medicare. Reviewing the patient's medical and social history is a great opportunity to learn about the patient's family history, as well as the use of alcohol, tobacco, or illegal drugs, all of which are contributing factors to developing kidney disease. This exam will also include taking vitals such as blood pressure, which will allow for the discussion if it is elevated. Here's a list of codes that may be applicable when billing for the initial preventative physical exam. Again, this exam should occur no later than 12 months after the beneficiary's Part B effective date. There is no cost for the face-to-face visit, which would be billed using code G0402. Codes G0403 through G0405 are for electrocardiograms, which is why coinsurance and deductible would apply. G0468 is specifically for federally qualified health centers and includes services that would otherwise be billed using G0466 or G0467. There would be no out-of-pocket cost to the beneficiary. The annual wellness visit is covered once every 12 months and should not be performed within 12 months of the patient's Part B entitlement or the date of their initial preventative physical exam. Again, blood pressure will be taken as part of their vitals. At this time, healthcare professionals can screen patients for any substance abuse and refer them to treatment if necessary. I mentioned earlier that cocaine, heroin, and amphetamines are potential causes of chronic kidney disease. If the patient is smoking, referrals for tobacco cessation services can be discussed. This slide gives you the billing information. The very first annual wellness visit would be billed using code G0438. This code is covered once per lifetime. All subsequent visits would be using codes G0439 or G0468, depending on the type of facility. Codes 99497 and 99498 are optional codes that can be used when advanced care planning discussions are part of the visit. This is an annually covered service. There is no cost to the beneficiary. Again, G0468 is for federally qualified health centers. This slide shows the CMS Internet-only manual reference for rural health clinics and federally qualified health centers. Section 60.2 does provide additional information on how to bill HCPCS G0468. If advanced care planning is provided, codes 99497 and 99498 should be billed with modifier 33 on the same claim as the annual wellness visit. Please note that this service should occur on the same day and by the same provider as the annual wellness visit. According to the American Heart Association, cardiovascular disease can refer to several conditions, including heart disease, stroke, and heart failure, just to name a few. Blood tests for cholesterol, lipid, and triglyceride levels are covered under Part B for patients without apparent signs of cardiovascular disease. There is no out-of-pocket expense for the patient. As you can see here, there are specific tests that should be included in the lipid panel. Claims should be billed once every 5 years with diagnosis code Z136. Behavior therapy to help lower the risk of cardiovascular disease is covered under Part B with no cost to the beneficiary. If you look at the list of risk factors, you can see that cardiovascular and chronic kidney disease share some common risk factors. Services should be furnished by a qualified primary care physician or other primary care practitioner in a primary care setting. Code G0446 should be used for face-to-face therapy sessions and can be billed annually. Obesity is becoming a common issue in the United States. Increased body fat can lead to a greater risk of high blood pressure, type 2 diabetes, and kidney disease, along with other medical conditions. Intensive behavior therapy is covered under Medicare Part B for patients who have a body mass index or BMI of greater than or equal to 30 kilograms per meter squared. Reassessments will need to be done after 6 months to determine if the beneficiary is eligible for additional face-to-face visits. There is no cost to the beneficiary. Codes should be billed with G0447 or G0473 and one of the diagnosis codes listed here. Medicare will cover up to 22 visits. This includes weekly visits for the first month, bi-weekly for months 2 through 6, and additional monthly visits during months 7 through 12 if the patient qualifies. Alcohol can affect your kidneys in a couple different ways. Since alcohol is seen as a waste product that should be removed from the body, drinking excessive amounts will cause the kidneys to work harder. Alcohol also dehydrates the body, which in turn makes the kidneys work harder to try to balance the body's fluids. For patients who screen positive for alcohol misuse, services are covered at no cost under Medicare Part B. We'll talk about misuse versus dependency shortly. Counseling should be provided by a qualified primary care physician or other primary care practitioner in a primary care setting. The screening is covered annually and would be billed using code G0442. Counseling is covered for up to 4 sessions per year and should be billed using code G0443. Here we see the guidelines for misuse versus dependence. Risky or hazardous drinking focuses on the number of drinks, whereas harmful focuses more on the person's behavior. Dependence is defined as the patient having 3 or more of the behaviors listed on this slide. These definitions were found in CR 7633, which is provided as a resource. The last preventive service I'll be speaking about today is tobacco use. Smoking slows blood flow to important organs, which can worsen kidney disease. This can also cause problems in beneficiaries diagnosed with diabetes, since restricted blood flow to the feet can result in sores and infections taking longer to heal. Smoking can also interfere with medication used to treat high blood pressure, which is the second leading cause of chronic kidney disease. Medicare will cover up to 8 sessions in a 12-month period under Medicare Part B at no cost to the beneficiary. Counseling should be provided by a qualified physician or other Medicare-recognized provider and is available to any patient who uses tobacco regardless of whether they have a tobacco-related illness. Services should be billed using code 99406 or 99407 and one of the diagnosis codes listed on this slide. Patients are allowed 2 cessation attempts per year, with each attempt consisting of a maximum of 4 counseling sessions. In your resources, a link to the CMS Preventive Service Tool has been provided. A lot of the information presented today can be found on this website. This is also a great tool to find billing information and coverage criteria for other preventative services that Medicare covers. One of the other things I like about this site is that it also shows if the services are eligible for telehealth. So it does that on the main screen. You'll have the T, which is circled, and then once you get into the individual services, such as the annual wellness visit, it says that it's telehealth eligible and shows the computer and the cell phone. Here's the list of resources that I found very helpful. This list does include the CMS Preventive Screening and Services Tool, along with the Medicare Coverage Database. Okay, that is all that I have for today. Aline, do we have any questions?
Thanks, Karen, for all that great information. I have not seen any questions in the chat. Just as a reminder, if you do have a question, make sure you're sending it to all panelists and not the host or the host and presenter, because that way I wouldn't see it. So at this time, I'm scrolling through, and I do not see any questions at this time, Karen.
Okay. Well, please take a few minutes now to complete a survey. Tell us what you liked, what we could do better, and suggest topics for future education. Your feedback really is invaluable to ensuring education that is timely and effective. There are different options depending on your preference. You can scan the QR code that you see here and on the next few slides. You can use the link in the chat, or when you exit the webinar, you'll be asked to go to an external site. It'll show up as this right here with the yellow triangle. The external site is the CMS Qualtrics page for the survey, so it's not spam. In a few minutes, you will receive an email to thank you for attending. Do not delete it without reading it. This email contains your certificate of achievement. The email will look like what you see on the screen. It has your name and the contact hours if you need to turn it in for credit towards continuing education units. If you don't see it, make sure to add the WebEx email address to your Safe Sender list. If you think of any additional questions, you have 10 days from today to submit them. Send them to our education mailbox and put today's date and kidney health in the subject line. Aline, has anything come in?
No, ma'am, I do not see any questions.
Okay. Then on behalf of myself, Aline, and the Provider Outreach and Education, thank you for your participation. We look forward to your survey comments and hope to have you join us for future events. You may now disconnect.